This combination product is used for the temporary treatment of cough, stuffy nose, and sinus pain/pressure caused by infection or other breathing illnesses. It contains a decongestant that works by narrowing the blood vessels to help relieve stuffy nose symptoms and sinus pressure. It also contains a non-opioid cough suppressant that affects a certain part of the brain to help you stop coughing. It's important to talk with your doctor before using this product for a chronic cough from smoking or a cough with too much/thick mucus. Cough and cold products have not been shown to be safe or effective in children younger than 6 years, and some products are not recommended for use in children younger than 12 years. It's important to ask your doctor or pharmacist for more details about using your product safely. These products do not cure or shorten the length of the common cold and may cause serious side effects, so it's important to carefully follow all dosage directions. It's also important not to use this product to make a child sleepy, and to avoid giving other cough and cold medication that might contain the same or similar ingredients. It's essential to ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Rondec-D, it's important to follow the directions on the package. If you have any questions, ask your doctor or pharmacist. If your doctor has prescribed this medication, take it as directed. You can take the tablet, capsule, or liquid form by mouth with or without food. The dosage is based on your age, medical condition, and response to treatment. Do not increase your dose or take this drug more often than directed. Do not take more of this medication than recommended for your age. If you are using the chewable tablets, chew each tablet well and swallow. If you are using the liquid form of this medication, measure the dose carefully using a special measuring device/cup. Do not use a household spoon because you may not get the correct dose. Caffeine can increase the side effects of this medication, so it's best to avoid drinking large amounts of beverages containing caffeine or eating large amounts of chocolate. Improper use of dextromethorphan, abuse, may result in serious harm. Do not increase your dose, take it more often, or use it for a longer time than directed. If your symptoms do not improve after 7 days, if they worsen or return, if you develop a headache that doesn't go away, fever, or rash, or if you think you may have a serious medical problem, get medical help right away. Some common side effects of Rondec-D may include nausea, vomiting, trouble sleeping, dizziness, headache, or nervousness. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist. If your doctor has prescribed this medication, it is because they have determined that the benefits outweigh the potential risks of side effects. Many people using Rondec-D do not experience serious side effects. However, it is important to stop taking the medication and seek medical attention if you experience serious side effects such as fast, irregular, or pounding heartbeat, changes in mental/mood, such as confusion, hallucinations, nervousness, seizures, shaking, tremors, or difficulty urinating. While rare, a very serious allergic reaction to Rondec-D may occur. Seek immediate medical help if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It is important to note that this is not a complete list of possible side effects. If you experience any other effects not listed, it is important to contact your doctor or pharmacist. If you are in the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Rondec-D, make sure to inform your doctor or pharmacist if you have any allergies or negative reactions to sympathomimetics. Also, consult your doctor or pharmacist if you have any health problems such as chronic cough, diabetes, heart problems, high blood pressure, liver disease, overactive thyroid, difficulty urinating, or any other medical conditions. This medication may cause dizziness, especially when combined with alcohol or marijuana. Avoid driving or operating machinery until you can do so safely. Be cautious if you have diabetes, alcohol dependence, liver disease, or phenylketonuria, as the liquid or chewable forms of Rondec-D may contain sugar, alcohol, or aspartame. Before undergoing surgery, inform your doctor about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults and children may be more sensitive to the effects of this medication. If you are pregnant, use Rondec-D only when clearly needed and discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions when taking Rondec-D. This can affect how the medication works and may increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain MAO inhibitors with Rondec-D, as it may cause a serious and possibly fatal drug interaction. This includes medications such as isocarboxazid, metaxalone, and phenelzine. It's also important to check the labels on all your medicines, as they may contain similar ingredients. Always ask your pharmacist about using these products safely. And remember, always consult your doctor about the best time to take this medication and the correct daily dosage. If someone has taken too much Rondec-D and is showing severe symptoms like fainting or difficulty breathing, it's important to call for emergency help right away. In the US, you can call the local poison control center at 1-800-222-1222. In Canada, residents can contact their provincial poison control center. Symptoms of an overdose may include agitation, confusion, hallucinations, and seizures. Remember, it's always better to be safe and seek help if you're unsure. Remember, Rondec-D is only meant for short-term use. It's important to consult with your doctor if you need to use it for more than 7 days. If you are taking Rondec-D on a regular schedule and you happen to miss a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Do not double the dose to make up for the missed one. When it comes to storing Rondec-D, it's important to follow the specific instructions on the product package or ask your pharmacist for guidance. Make sure to keep all medications out of reach of children and pets. It's also crucial to properly dispose of Rondec-D when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. Avoid flushing the medication down the toilet or pouring it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.